I'm Samantha Schultz, and I'm presenting from Nurse 500 Ethics for the F&P class for Coppin State University. I'm evaluating an article. It is written by Dr. Haider, Schneider, Sriram, Dossick, Scott, Swoboda, Efron. It was in 2015. The name of the article is Unconscious Race and Social Class Bias Among Acute Care Surgical Clinicians and Clinical Treatment Decisions. It was written in JAMA Surgery. It was the 5th edition and was pages 457 to 464. So, the author's qualifications range from Masters of Public Health, PhD, Masters of Science, and RN. Dr. Haider was the lead investigator and is responsible for all the data involved in the study. The study design was organized by Dr. Haider, Schneider, who is a PhD, Swoboda, who is a RN, Dr. Dossick, Dr. Hott, Dr. Efron, Dr. Provost, Dr. Lipset, Dr. Cornwell, and Mackenzie, who is a PhD, Dr. Cooper, and Dr. Frischleg. The acquisition, analysis, or interpretation of the data was conducted by Dr. Haider, Schneider, who is a PhD, Sriram, who is a PhD, Dr. Dossick, Scott, who is a Master's of Science in Public Health, and Swoboda, who is an RN, Dr. Lozonsky, and Dr. Lipskit, and PhD Mackenzie. The standard classifications of D-scores were used to create a 7-point implicit preference scale. A D-score of negative 0.15 to 0.15 indicated that there was no preference. 0.16 to 0.34 showed a minor preference. 0.35 to 0.64 indicated a moderate preference. And a D-score of greater than 0.65 indicated a strong preference. Partialities for race and social class were measured using a 10-point thermometer scale. The scale assessed the participants' self-reported comparative warmth toward black versus white and upper class versus lower class individuals. Preferences that are implicit are often unrecognized and can be considered unconscious bias. Preferences that are explicitly stated and recognized are conscious bias. These implicit D-scores were equated with a 7-point composite scale using explicit preferences and Spearman correlation coefficient for race and social class. The ethical principles of justice underlie this article. Justice relates to fairness of treatment in healthcare. An example from this study is the statement, clinicians in the study were also less likely to order an MRI of the cervical spine for patients with neck tenderness after a motor vehicle accident if they were of a low income status versus a high income status. This statement shows that if an individual came into the ER and were of a low socioeconomic status, an MRI would not likely be ordered by a clinician, which is considered unequal healthcare treatment. By not ordering this MRI, this low socioeconomic patient could have a fracture or a spinal injury that may go undiagnosed or untreated. A practitioner who is aware of unconscious bias should recognize these differences in their choices in diagnosis and interventions when they treat patients. By recognizing their implicit bias, practitioners can utilize best practice and prior experiences to treat patients for the best possible outcome. This will create a more fair and equal health outcomes for all patients. Thank you.